Marley Drug.
Hello, welcome to Ask Marley Drug. My name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. So today we're going to talk about commonly asked questions I get for a medication called Esomeprazole, also known as Nexium. Plus, I'm going to share with you 4 things to look for if you're taking Esomeprazole long term. So what is Esomeprazole and how does it work? Well, Esomeprazole is a prescription medication that belongs to a drug class of medications known as proton pump inhibitors and is commonly abbreviated as PPIs. It works by blocking the production and release of acid into your stomach. Esomeprazole is FDA approved for the treatment of GERD with erosive esophagitis, which is damage to the esophagus from stomach acid caused by gastroesophageal reflux disease, or GERD. It's also approved for Zollinger-Ellison syndrome, which is a rare digestive disorder that results in too much gastric acid, and other diseases that result in excessive stomach acid production can be treated with esomeprazole. This medication is essentially used to treat conditions that are caused by too much stomach acid, such as heartburn or acid reflux. Esomeprazole is available in 20 mg and 40 mg capsules with a prescription and is also available over the counter as a 20 mg capsule and tablet for heartburn. Over-the-counter esomeprazole should only be used for 14 days at a time, but your healthcare provider may recommend taking it for longer than that. The over-the-counter and prescription products contain the same active ingredient, which is esomeprazole, so they work the same way and have the same side effects. If you cannot swallow a capsule whole, open it and sprinkle the medication into a spoonful of pudding or applesauce. Swallow the mixture right away without chewing. Do not save it for later use. The late-release medications are used in all esomeprazole formulations. This indicates that instead of the stomach, your intestines are where this drug is released. This stops the medication from being metabolized by your stomach before it can work as intended. So when is the best time to take esomeprazole? Well, it's best to take esomeprazole 1 hour before a meal with a full glass of water so that it can start working before you eat. However, it can take a couple days for you to feel its full effects. So what if I miss a dose? If you do forget to take a dose, take the missed dose as soon as possible. If it's almost time for your next dose, skip the forgotten dose and take the next one at the regular scheduled time. Do not take 2 doses at the same time. What are the side effects of esomeprazole? Well, like all medications, esomeprazole has a few side effects. Some common side effects include headache, abdominal pain or bloating, dry mouth, gas, nausea, vomiting, diarrhea, joint pain. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Some serious adverse effects of esomeprazole that you should be aware of include severe abdominal pain, including diarrhea that's watery or bloody. 2, you may develop low magnesium levels, especially if you take the medication for at least 3 months. So some signs of low magnesium levels may include dizziness, increased and abnormal heart rate, shaking, muscle cramps, and spasms in your arms or feet. 3, low levels of vitamin B12 may develop if you've been using esomeprazole for a long time. Esomeprazole lowers the amount of acid in your stomach, which is needed for vitamin B12 absorption. So I recommend consulting your doctor if you take vitamin B12 or supplements. 4, bone thinning and weakness may increase your risk of fractures. So if you're using this medication on a long-term basis, you might require calcium and vitamin D supplements to help avoid fractures. Your chances are higher if you take esomeprazole for a year or longer, if you take more than 1 dose a day, or if your doctor prescribes a higher dose. It's therefore recommended to use esomeprazole at the lowest dose and for the shortest amount of time possible for your condition. So if you're experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. Can esomeprazole interact with other medications? Yes, it can. Esomeprazole may interact with certain medications or supplements. So always let your doctor and pharmacist know about any other medications or supplements, including prescribed and over-the-counter medications, vitamins, and dietary or herbal supplements that you're currently taking. Using esomeprazole with certain medications like warfarin, methotrexate, rifampin, or citalopram may cause an increased risk of certain side effects. So like all medications, you should speak to your pharmacist or your healthcare provider about any questions you may have. There's lots of information on esomeprazole, GERD, and other health conditions on our website. Check out our blogs in the links below. And if you have any questions, just drop them in the comment section below and don't forget to subscribe. Bye for now.